Hey, how's it going?
Good, how are you?
Good, thank you. All right, my name's Caitlin Getchell, and I'm a doctor of physical therapy student at the University of St. Augustine. So before we begin, can I have your full name and date of birth?
Charlie Quito, 0219, 1993.
And let me check your band, please. Perfect. So I understand you're here today because you have a muscle strain in your right leg and it's causing you some pain. Is that accurate?
Yep.
So what I'd like to do today is a moist hot pack treatment. And basically that's going to apply heat to the back of your leg and it's going to help reduce the pain. Does that sound like something you're interested in?
Sure.
So some of the contraindications, which means we shouldn't be doing this procedure, are if you have peripheral vascular disease, a burn on the back of your leg, any kind of cancer or open wounds or infections. Do you have any of that you know of?
Nope.
And then some precautions, which are things we just want to be worried about but keep an eye out for, are deep vein thrombosis or DVT, impaired circulation, or chronic edema, which you don't seem to have. So does that sound like something we'd like to do today?
Sure.
All right, so some of the effects are going to be that the moist hot pack elevates your pain threshold, which in turn is going to decrease your pain.
Okay.
And then the heat is also going to improve vasodilation, circulation, as well as metabolism, which is in turn going to help heal your wound.
Okay.
So if you'd like to begin, if you could take your shoes off and then lay your head down on the table with your stomach.
Sure.
Is this a comfortable position for you?
It is.
Okay. So before we begin, I'm going to go ahead and ask you for a pain number. So on a scale of 0 to 10, 0 being no pain at all and 10 being the worst pain that you have to go to the hospital, where are you at right now?
I'm at about a 5.
Okay. Do you mind if I roll your shorts up?
Sure, that's okay.
Yep. That way we can expose the whole muscle. There you go. And then first what I'm going to do is a skin inspection. So I'm going to make sure that you don't have any rashes or wounds and it looks like you're doing okay. And the next thing I'm going to do is palpate, which means I'm just going to put some pressure onto your muscle. And then if you feel any pain, just go ahead and let me know.
There is some pain there.
Okay. What about everything?
Yep.
Okay.
Yep, still painful.
Okay. So now we're going to go ahead and do a sensation test.
Okay.
So what I'm going to do is rub this cotton ball against your cheek with your eyes open, and when you feel it, you're going to say yes.
Okay. Yes. Yes.
Okay, now go ahead and close your eyes.
Yes. Yes.
All right, you can go ahead and keep your eyes closed, and I'm going to come down to your leg. Let me know if you feel it.
Yes. 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 Yes.
Great. So now what we're going to do, this is the moist hot pack. So I took it out of the hydroculator, and it was at 165 degrees Fahrenheit, which is in range for what it's supposed to be.
Okay.
And then I also have it with 7 layers. That's going to be between the hot pack and your skin, and this is going to make sure that you don't get any burns or tissue damage.
Okay.
So I'm going to go ahead and place it on, and then I want you to let me know if it feels all right. How's that?
Yep, that feels good.
All right. So the treatment time is normally 15 to 30 minutes, but since it's your first time, I'm going to check in with you after 5, and then we're going to inspect the area and make sure everything's okay.
Okay.
And then here I have a call bell, and this is for if you need me for anything, if anything feels uncomfortable, it falls off, or just anything.
Okay.
So I'll do that. All right, so your 5 minutes is up. I'm going to go ahead and take this ball off. And we're going to skin inspect again. Everything looks good. And then I'm going to go ahead and test your sensation just to make sure everything's still intact. So do you remember with your eyes closed?
Mm-hmm.
Okay.
Yes. 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 Yes.
Great. So the remainder is going to be about 15 to 20 minutes. So I'm going to go ahead and apply the moist hot pack again. All right. And then I'll come back. All right, so your 20 minutes is up. We're going to go ahead and remove this. We're going to perform one more skin inspection.
Okay.
And again, no abnormal responses. And then lastly, I'm going to do one more sensation check.
Okay. Yes. 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 Yes.
Great. So now, with that being done, if you had to rate your pain again on that same scale of 0 to 10, how would you rate it?
It feels like it's a about a 2.
About a 2?
Mhm.
Okay, so the next thing that we could do with further intervention is soft tissue massage, so we can do some kneading.
Okay.
And then we can also stretch your hamstring, and that's gonna help with your condition. Does that sound okay?
Sure.